Bovine viral diarrhea is caused by a pestivirus. This virus can be transmitted from cow to cow via body fluids, as well as across the placenta of a pregnant dam to her calf. A naive cow exposed to a BVD-infected cow will become transiently infected and produce antibodies against this virus before recovering. If a naive cow is exposed to the BVD virus during days 40 to 120 of pregnancy, she will produce a calf with an immune system tolerant to the virus. These calves are persistently infected, or PIs, and will shed the virus particles in all secretions and feces for the rest of their life, potentially infecting the rest of the herd. Reproductive losses include: if a naive cow is exposed to the BVD virus before day 40 of pregnancy, abortions or return to service will occur. BVD infection in bulls can cause infertility. Production losses include: in young animals, the virus causes diarrhea, weight loss, immunosuppression, which all lead to higher animal health costs. In older animals, the virus causes immunosuppression and lower milk yield. The ELISA test is a lab test which detects the presence of antibodies to the BVD virus in the milk. Any cow in the milking herd which has come into contact with the virus will form antibodies as part of the body's defense. Your result shows very high exposure on your farm, meaning there is likely to be an active BVD infection in your herd. The bulk milk PCR test detects the presence of the BVD virus in the milk. Your farm's result has come back negative. This means there is no persistently infected animal present in your milking herd. Therefore, there is likely to be a PI somewhere else on the farm, such as in the mastitis herd, young stock, or bulls. How to find the PI. Start by screening young stock. There are two methods of doing this: direct or indirect testing. Direct testing is the recommended procedure. A positive result indicates either a transiently or a persistently infected animal. Animals that test positive should be resampled 3 to 4 weeks later to confirm whether or not it is a PI. Confirmed PI should then be culled. Indirect testing should only be used if there is a low chance of a PI in the herd and the farm has good biosecurity. This is not the case on your farm. All bulls should be BVD tested before having contact with the herd and culled if positive. How does BVD affect you? With an actively infected BVD herd, the cumulative reproduction and production losses are likely to be causing you a significant financial loss. The average annual cost to New Zealand farmers with an actively infected herd is $70,000. This is based on an average herd size of 386 cows and a payout of $650. Therefore, this economic loss justifies implementing control measures to eradicate BVD. Eradication of PI animals involves identifying the PIs and culling these animals. Eradication of BVD is a good idea, but eradication alone as a control measure is risky, as the herd becomes naive to the virus and so is susceptible to an outbreak if the virus is reintroduced. The three main areas for maintaining biosecurity are testing all cattle coming into the property, testing cattle going off the property and returning pregnant at a later date, and changing management practices to limit exposure to neighbouring stock. Vaccination as a control measure would require annually vaccinating the milking herd before the start of mating, vaccinating all bulls before mating, and vaccinating any cows entering the milking herd. Vaccination only provides a short-term protection and therefore requires annual boosters. Levels of protection may be variable because it depends on the strains of virus used in the vaccine and how closely related they are to those on the farm. Vaccination only as a control method is not ideal because it does not eliminate PIs from the farm. Combining eradication and vaccination all animals is the best method of control to protect them in case the virus gets reintroduced. Although there is a cost to testing and vaccinating, the excellent protection given by this option is likely to have an economic benefit for your farm that greatly outweighs the cost. Setting up a monitoring program is important to maintain a BVD-free status on your farm and to see if the control method we have put in place is working. This requires direct testing calves annually, an annual ELISA test of the whole herd, which is best to do in the middle of spring, and checking for significant rises in antibody levels from this test, which would warrant further investigation. It is also important to record movement of stock on and off the farm. Our recommendation is to aim to eradicate BVD from your farm, prevent new infections, and maintain a BVD-free farm. To do this, direct test the milkers left out of the herd on the day of the last PCR, direct test all cattle on the property that are not in the milking herd, including bulls and young stock. If an animal tests positive, it should be retested in 3 weeks' time to determine whether the animal is a PI or just transiently infected. Cull animals which test positively twice because they are confirmed PIs. To prevent more animals being infected, put in place an annual vaccination program for breeding cattle and bulls before the start of mating. Direct test and vaccinate new cattle coming onto the farm.